Welcome back. Nurse practitioner Erin Kunzweiler and Dr. Douglas Kunzweiler are still with us. And we're going to talk more about the relationships between physicians, nurse practitioners, and physician assistants, and what you need to know as a patient under the care of any of these healthcare professionals. So welcome back.
Thanks.
Sometimes a person makes an appointment with their doctor, whether MD or DO, and when that person goes to the appointment, they're surprised because maybe a nurse practitioner or a physician assistant comes into the room. So talk about that, and is it okay for the patient to be not okay with that?
Yeah, absolutely. Really, that shouldn't happen. When you make an appointment, certainly at any clinic, you should know who you're seeing, and that should be made very clear by the the front desk personnel that you're seeing an MP or a PA, and there should not be any surprise that if you go and you have an appointment with a physician, if that's your practitioner of choice, that you would then be seen by an MP or PA. Mainly I'm speaking, again, in clinic settings. It's a little bit different, though, in urgent care and the emergency room, where nationwide, the team in those settings tend to be a mix of PAs, MPs, and MDs or DOs. So maybe you can talk about that.
Yeah, especially in the emergency department, because of the volume of patients, it's impossible to staff with all physicians. And so we use a mix of nurse practitioners, physicians, assistants, and then physicians, of course. And we all work collaboratively. If the nurse practitioner or the PA sees a patient that they're having trouble with, I'm right there in the department. They come and talk to me. I go see the patient, and together we work to help them. And so in the emergency department and in some urgent cares that are really busy, you might not have a choice initially, but you can always ask to see a physician, and we'll come and see you.
Okay, so we're going to switch back to you, Erin. Okay. Some people choose their practitioner, whether it be an MD or a nurse practitioner, based on gender. They feel more comfortable, for example, being seen by a female.
Sure.
And then sometimes you go into that appointment and you're surprised because instead of being seen by a female, you're seen by a male. So what should a patient do in that situation? And is it okay to not be comfortable with that?
Yes, it's okay to not be comfortable with that. And I would go back even to the first question, that it really shouldn't happen. There's many patients that prefer a male over a female, and the whole basis of a patient and provider relationship is trust. And so absolutely, the patient should, if they're uncomfortable, just say, I prefer the male or male or female. And again, when you make the appointment, just be very clear that you're seeing who you're making the appointment with. And in general, it shouldn't be an issue. The patients should absolutely be accommodated.
To that point, and to carry it one step further, what should a patient do if they really are uncomfortable with not being seen by an MD and being seen by a nurse practitioner?
Yeah, they should either address it with the manager of whatever clinic they're at, or if they're comfortable enough, you can just say to the provider that's in the room that I would rather be seen by the physician. And that's okay. That's a patient choice, and it's absolutely okay for them to address their own needs that way.
So now I'm going to switch to you, Dr. Kunzweiler, back to you. So when you think about nurse practitioners and MDs, credentials aside, we're all concerned about quality of care for patients. So how can a patient feel really good that the care they're receiving is of the highest quality possible?
Well, I think it is difficult. It is good, I think, to talk to family and friends about who they're seeing and how they feel about their practitioner. So I think that's one way to get useful information. You can go online and find out about people's training and background. But I think ultimately you should feel that it's your right to ask questions of the practitioner, whoever they are, You should ask if they have experience in the kind of problems that you have. And then you should just get a feeling for, do I like the way they answer my questions? Do I feel like they're really listening to me? Does the treatment plan that they've outlined make sense? So I think you have to use all of these resources, and it really just comes down to, forming a relationship with your provider, whoever they are, whatever their credentials, and feeling that, they listen to you and that their answers make sense and that they're willing to get help if they need it. I think we all at times encounter problems that we're not familiar with, and whoever is taking care of you needs to be open to getting advice from other specialists and other practitioners. So not really an easy answer, but I think you just have to keep working at it like any relationship until you feel comfortable with the person. And if you feel like they're not listening to you or they're not really trying to help you, then I think you have to look for somebody else.
Anything you want to add to that, Erin?
No, I think the most important point that you said was patients need to feel that they're being listened to, that they're being heard, and every decision that's made is a decision made between the patient and the provider, and the patient has to be comfortable with that.
And so insurance can be an issue. In the few seconds that we have left, any advice to a patient when they're concerned that their practitioner might not accept their insurance?
Yeah, I mean, that is an issue, and really you just have to find out who is in your network before you make appointments. And generally, if you're calling the front desk of any clinic, they're aware of what insurances are accepted and who's in network. So it's really just a matter of digging in a little bit that way.
Well, we're out of time, and this has been a helpful discussion. Thank you both for being here with us this morning, and thank you so much for watching. We hope to see you again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.